has been quick to respond to the threat of COVID-19. On the 29th of January, 37 days before South Africa's first diagnosed case of COVID-19, our Minister of Health, Dr. Zweli Mkhize, activated the Emergency Operations Center at the National Institute of Communicable Diseases. This gave us a relatively good lead time to prepare for COVID-19. So let's support government. Spread facts, not fear. Because together, we can beat this.
Hello, welcome to Health Talk. Now, the coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus. The world is currently grappling with this pandemic. And here at home, President Cyril Ramaphosa has declared the COVID-19 outbreak a national state of disaster in terms of the Disaster Management Act. As of today, the 1st of April 2020, the total number of confirmed cases in South Africa is 1,353, with 5 deaths from the virus. Today is day 6 of a 21-day national lockdown, where people have been urged to stay at home and only go outside for food, health reasons, or for essential work. And two of the most important questions that are being asked are, how can we prevent the spread of the virus? And how can you and I protect ourselves from contracting the virus in the first place? Well, on the program today, we'll be focusing on healthcare workers who are quite literally on the front line of this war against the virus. We'll also be taking a look at COVID-19 testing. The situation in our prisons, as well as the all-important precautionary measures that we can all take to minimize the risk of infection. All of this and more coming up on today's show. Right, but first, COVID-19. Well, that's wreaking havoc around the globe with the infection numbers rising rapidly. And according to statistics, and I can tell you this is at 8:30 Greenwich Mean Time, 860,181 people were confirmed with the virus. 42,300 deaths recorded globally, and 169,631 recoveries have been reported. And that's an important number because people are recovering. Well, South Africa is now the epicenter of the pandemic in Africa, recording more than 1,300 confirmed cases across the country's 9 provinces. Let's take a look at the statistics as of yesterday, starting with the least infected provinces. And this is the story. The Eastern Cape is sitting at 12 infections. Limpopo has 14. The Northwest Province has 8. And the Northern Cape has since recorded 6. No deaths have been reported in these 4 provinces so far. At the other end of the scale, well, there are these provinces, sadly, with the highest numbers of infections and mortalities. Gauteng, that's leading the pack with a record 633 infections and sadly 1 death. KwaZulu-Natal is standing with 179 infections. 2 people have passed away from the virus. Followed closely by the Western Cape with about 325 infections and also 1 confirmed death in that state, that province. Now, the Free State is on 74 infections, also recording its first death as announced on Monday night by President Cyril Ramaphosa. So, and that was 4 days into the national lockdown. And lastly, Mpumalanga only has 12 cases at this stage and no deaths recorded. So that brings South Africa's total, as I said, to 1,353 confirmed cases. And please note that as we observe and report on these numbers and these cases, these can change quite significantly and quite quickly. And you can help flatten the infection rate curve by following those regulations that have been set down for us for the lockdown. And if you want to stay informed regarding the coronavirus statistics, then you can visit the NICD's website for updates. So that's what we have in store. That's the COVID-19 situation at the moment. And to help us understand this disease a little better and the impact that it's having, we'll be joined on the program by a number of voices. The Deputy Director General for Health Programs at the National Department of Health. We'll also hear from the spokesperson for the Department of Correctional Services, along with the South African Prisoners Organisation for Human Rights. We'll also talk to the Head of Department of Medical Virology at the National Health Laboratory Service, and Professor Guy Richards. And don't forget, and very importantly, you too can be a part of the show, and you can ask any of our guests some of the questions that you have in your mind, or you could simply share your views with us that we're discussing. The number to call, as always, is +27 if you're outside the country, 11714 5861 or 5877. So that's +27 11 714 5861 or 5877. Really want to hear from you. You can also reach us via Twitter using our handle, which is @SABC Health Talk, or you can interact with us on our Facebook page, which is SABC Health Talk. Okay, we have a lot to get through, a lot of information to share, so sit back, relax, and let's learn together from this bumper show ahead. All coming to you after this short break. And by the way, I'm Peter Ndoro, and I'm standing in today. Hello, welcome back. You're watching Health Talk. Thanks very much indeed for joining us. Now, the Minister of Health, Dr. Zweli expressed his concern this past week that a number of confirmed COVID-19 cases of health workers who work both in the private and public hospitals has been noted. This including doctors and nurses, and he's worried, as he says, health workers are in the front line of this battle. He emphasized, though, that none of these health workers were infected by patients that they were treating. 13 healthcare workers, we believe, have tested positive for COVID-19 so far. So what does all of this mean? Well, joining us via Skype is Dr. Yoken Pillai, who's the Deputy Director General for Health Programs from the National Department of Health. Very good morning to you, Dr. Pillai. Thanks so much indeed for joining us.
Good morning, Peter, and good morning to the viewers.
And we're hoping to have on the line as well Professor Guy Richard, Emeritus Professor at the University of the Witwatersrand. Prof, thanks very much indeed for joining us. Are you on the line?
I am, yes. Good morning.
Thank you so much indeed. All right, so let me start with you, Dr. Pillai, and my question for you, are our health workers safe on the front line?
Well, we want to ensure that health workers are as safe as possible, but working in a hospital almost by definition has its risks. We have fairly stringent infection prevention and control measures in place, and of course with personal protective equipment, the idea is to ensure that our health workers, our frontline health workers, and Peter, not only health workers, the cleaners in the hospital, the laundry folk, as well as the catering folk, all need to be protected, and we are doing the best we can to ensure that they are protected. And the pathogens in the hospital are not only around COVID. There's TB in our hospitals, and there's bloodborne infections that can be passed on to our health workers and other auxiliary workers as well. So we think we're doing all we can, but of course, we can always do more, and we ask everybody, patients, families, as well as health workers, to take every care possible to ensure that nobody gets infected.
I would imagine that it's in some way a good indicator that the ones that have been infected so far haven't been infected by patients.
Well, that's true. Of course, we don't know where people get infected often. But it's also true that we don't currently have many patients in our hospitals who are infected.
Right.
The numbers are still small. Most people with symptoms currently have mild symptoms and are either self-quarantining at home or somewhere else. So, the bulk of the patients are not in our hospitals.
All right.
When that starts to happen, of course, we are likely to see a greater
shift.
risk for health workers.
All right, we'll chat a bit more about that. But Prof, let me ask you on the line. I know that you're in contact with a lot of doctors and advising them, and I just wonder the kind of questions that they're asking and the concerns that they're raising whilst they're doing their jobs during this pandemic.
Yeah, I think that is a very important issue. There are a number of common questions that people ask, and those are things like how would they protect themselves, and that would imply the use of personal protective equipment. It would also look at whether there is any prophylaxis available that might be able to decrease potential for infection. And then they're asking also as to whether there are any therapeutic interventions that are possible for the patients. And then if they get to the worst phase where they require mechanical ventilation, how precisely should those patients receive mechanical ventilation?
What's not often talked about, and I guess also these doctors are focused on the medicine, but this kind of thing, being in the midst of a pandemic, must play havoc on the mind and psychology. Is there, do you think, an important aspect that we need to consider, maybe just kind of have psychologists on hand to help these healthcare workers?
Well, that certainly has been the case overseas, and it also is the situation here. There is significant anxiety among healthcare workers, and that particularly occurs where there is a deficiency or an insufficiency of personal protective equipment. So we are or do have certain areas where these measures or these bits of equipment are not fully available, and that actually then would result in even further anxiety. But it's true that a psychologist would help and has actually been helping, certainly in the US, to help healthcare workers deal with it.
All right, Dr. Pillai, do we have enough resources for our doctors? We've mentioned protective gear. Is that all? There must be much more as well that they need to fight this very different battle.
No, Professor Richards is right. The first thing we need to do is provide them with an environment that is safe. And one of the issues there is around providing PPEs, personal protective equipment. And the National Department, together with the provinces, are increasing the orders that we place around PPEs, whether they are N95 masks, surgical masks, gloves, apron, visors, and the rest of it. There is a global shortage of PPEs. As you can imagine, every country is trying to protect their health workers as well as the general population. So there is some pressure on manufacturers. And this is, of course, being made more difficult by airlines not flying. So we are having, significantly lower volumes of PPEs coming into countries, and the manufacturers have a stress as well. But we have tried all manner of means to ensure that we don't only stock up all our facilities, but also have significant buffer stocks on PPEs. On the psychology issue, we are working with the Department of Social Development, who have a hotline on the psychosocial issues related to gender-based violence, as well as other issues that might relate to psychosocial issues. And some of the universities, like University of Johannesburg, have now come on stream as well.
All right, Prof, is there enough education? I mean, I think, doctors, health workers, they're taught at schools and in the hospitals how to treat these conditions as best they can. But is there enough, do you think, because it is new, it's very new, about the protocols and the things that they can do to protect themselves?
So none of us learned about the management of disease like SARS-CoV-2 or COVID-19, which is the actual disease caused by the virus. None of us learned about that in medical school. So this, yes, is a brand new thing, and there is an ongoing educational process. We managed or have managed a number of patients with highly infectious diseases such as Ebola and Crimean Congo fever and so on, but they were seen in low and small numbers. What we're facing now is a potential infectious condition which may arise in very large numbers, and it makes it much more difficult to manage the issue of personal protection. But we have, certainly at our hospital, an excellent group of infection prevention control officers who have been educating our staff on an ongoing basis. We've actually also, in this hospital, had training sessions almost on a weekly basis prior to this event in terms of how to don and how to dock the protective equipment. And this is really absolutely critical. As far as education is concerned in terms of the management, again, most of our therapies are more experimental than are based on randomized controlled trials. But the thing is that we are in the midst of a potentially lethal pandemic. When we say lethal, small numbers die relative to the total number. But in those that develop the severe illness, we do believe that there are certain medications that can mitigate the severity of it.
All right, and Prof, perhaps another important question, and I will explore this with Dr. Pillai again later, but maybe I can ask you, we're in the middle of this lockdown and we're talking about flattening this infection rate curve. Just how significant is that, and also in particular regarding our healthcare facilities?
Okay, so it is very important. The issue is that it depends on the number of patients we have in this country that fall into the severe category. Overall, those patients that have the disease, 90% or thereabouts, will have mild or asymptomatic infection. So you're left then with about 10% that will be potentially hospitalized, and of those 10%, about half might end up in the intensive care unit with severe oxygen requirements and ventilation and all the rest. Now, if you get a big surge of a very large number of patients occurring at one time, the potential is that you will completely overwhelm the ICU facility. So even though the vast majority of people who get this disease have a mild disease, if you have, for example, 100,000 cases, and 10,000 of those are going to end up in hospital, and 5,000 of those might be in ICU, that already would overrun by far the number of ICU beds that we have in the hospital. If we can flatten the curve and we can therefore spread the number of infections that occur over a longer period of time, then potentially we will be able to have the capacity to manage these patients in hospital.
All right, so Professor Guy Richards, Emeritus Professor at the University of the Witwatersrand, thanks very much indeed for your time this morning. Stay safe, and thanks so much indeed for your insights. Dr. Pillai, you're going to stay with us. We're going to chat to you a little bit further after this break. Stay with us. When we continue with our discussions, we're going to be looking at testing for the coronavirus. Stay with us for that. Hello, welcome back. You're still watching Health Talk. Now, government has embarked on a massive campaign to screen people for COVID-19. President Cyril Ramaphosa addressed the nation on Monday night, announcing that 10,000 healthcare workers will be visiting homes across the country to screen and test residents for the virus.
In the coming days, government will be rolling out a screening, testing, tracing, and medical management program on a huge scale. Around 10,000 field workers at the moment will be visiting homes in villages, in towns and cities to screen residents for the coronavirus symptoms. People with symptoms will be referred to local clinics or mobile clinics for testing. People who are infected with the coronavirus, but who have no or moderate symptoms, will remain in isolation at home or at a facility provided by government, and those with severe symptoms will be transferred to hospitals.
All right, okay, so there are laboratory tests that can identify the virus that causes COVID-19 in respiratory specimens, and this is according to the CDC. And the questions that we'll be asking on this segment is, who needs to be tested? How does one go about getting tested? And what do you do after you are tested? Well, still with us via Skype is Dr. Yogen Pillai, Deputy Director General for Health Programs at the National Department of Health. Dr. Pillai, thanks very much indeed for staying with us. And we're also joined by Dr. Florette Trenecht, who's the Head of Department for Medical Virology from the National Health Laboratory Services. Thank you so much for joining us and welcome to the program, Dr. Trenecht.
Thank you for inviting me.
All right, so let's start with you, and I'm just wondering about the test itself. How does it work?
So the test that we are using is a molecular test. So it basically looks for the nucleic material of the virus.
So what typically, what do we do? Do we get injected? Do we have a swab? What happens?
So the specimens that are being used is either a nasal or nasopharyngeal swab, so through the nose, or oropharyngeal swab or throat swab, which is then through the mouth. So that is what we call respiratory specimens. For patients that are really ill, they can then also provide either sputum samples or lower respiratory tract specimens, other lower respiratory tract specimens. And that is then used in the laboratory to isolate the virus's nucleic acid material and then do our test on that specimen.
All right. Dr. Pillai, we've got this testing going on now, and I'm just wondering, this massive rollout, what is it going to tell us and why is it important at this time?
So I think it's important to say the testing we've been doing to date is what we've called passive case finding, which means that people with symptoms will go to the doctor or a clinic, and on clinical examination with symptoms will be then referred for a swab and take a specimen and send it to the laboratory. What we now want to do, Peter, is actually do what's called active case finding. So we want to go into communities, especially those communities that we think are so-called hotspots, meaning they either have local transmission happening already or one or two people who are positive, but they are highly vulnerable communities where there might be a rapid spread of the virus if we don't do rapid containment. So the idea is to go into these communities, such as yesterday when the MEC and the Gauteng Department of Health went into Alex to screen and test people in communities. So we don't wait for them to come to clinics and hospitals, we go out to them. So this will tell us two things: how much of undetected transmission there is, and how many people with symptoms there are who have not presented to either their GP or their clinics. So this is now to move from passive case finding to active case finding. And the importance of that is to know where local transmission is happening. And if people are positive and can't self-isolate safely, we then offer them a quarantine facility outside their community so that we reduce the amount of community transmission there is from the individuals who are currently infected. So that's the difference between what has happened to date and what we're planning to do as announced by the President on Monday evening.
Do we have enough testing kits, enough resources to roll out the number of tests that we probably need to do?
So we will start with screening, and the screening is on the basis of symptoms.
Yeah.
And only the ones that have symptoms that are indicative of coronavirus infection will be tested. And Dr. Trenecht, I'm sure, will be able to tell us how the National Health Laboratory Service is gearing up to provide additional testing in communities, by mobiles, and in decentralized sites, because that's what we are planning with the NHLS. And I'm sure she can provide additional information on that.
All right, well, let's put that to you, Dr. Trenecht. You're going to have to do a lot of testing and do it quite quickly. And, you know, we're going to need to reach even the most remote places in the country, perhaps. Are we prepared? Do we have enough resources? Is there a plan?
Yeah, so at the moment we are trying to roll out, as Dr. Yoken Pillai was saying, to the communities that might not have readily access to these testing facilities. And, mobile units have been procured by the NHLS and is starting to roll that out in the various provinces. Also for the contact tracing that happened in the Free State, the same was done. Dr. Yogen referred to the exercise that was done yesterday in Alexandra Township. When it comes to the testing assays, as you were asked about as well, so all of the NHLS laboratories have test kits available to do testing. Also, what is being done by the CEO of the NHLS is to keep a record of all the tests that are available at each facility from a central point, so that where there is a bigger need, we can then basically provide it with more tests. We are also expecting kits to come in next week and the week after, also towards the end of this week. And that will allow us to be able to test these specimens that will come to the laboratory. Also, one of the strategies is because obviously we are affected by flights that have been cancelled and delays on freight that is coming into the country. So in order to overcome that, we actually have a strategy that we are not dependent on one supplier of these test kits, but multiple suppliers. And remember, it's not just the test kits, but also all of the other reagents that goes with our ability to perform the test, also our ability to be able to go out and sample the population.
And how are you working the public sector and the private sector? Because I'm hearing that people are doing it privately, and this is important, I guess, to get those statistics. How are you all working together?
So the statistics for testing that are happening both in the private and in the public sector are all collated by the Emergency Operations Center, which is located at the National Institute for Communicable Diseases. So all tests conducted, whether it's positive or negative, those results are being fed to them, and that is basically the numbers that the minister reports on a daily basis.
All right, so Dr. Pillai, who should be tested? You've talked about screening, but is it possible, and this is what we're hearing, that you could be quite contagious when you're asymptomatic? What could be another indicator to say maybe I should go and get tested? Is it just travel history?
So you'll recall, Peter, that when we started, we focused largely on people who are returning from overseas because these were so-called imported cases. But clearly now that we have stopped the flights from coming in, especially from the high-risk countries, and now that we are getting local transmission, anybody who's been in contact with somebody who's been diagnosed as positive should get a test. So we are no longer focusing only on those who have a travel history of having traveled overseas. So if you've been in contact with anyone who's been diagnosed positive, you should get a test. If you have any of the symptoms of coronavirus, we recommend that you get a test. We strongly recommend you get a test. And, so we will be changing the testing algorithm as we go along and as we see the epidemic evolve. So that's where we're at right now, Peter, on who should get tested.
All right, so Dr. Pillai, we'll continue to chat to you a little bit later on. But one last question for you, Dr. Trinik, and I'm just wondering about some of these viruses that mutate and you start to see different strains. Has that happened with COVID-19, or are we still seeing the same strain and testing for the same strain?
So at the moment, we're still testing for the same strain. And I think what is good about the diagnostic tests that are available is that the tests that are available, they also test for the sarbecovirus group. Hello?
Yes, carry on.
So the test allows us to also test for the sarbecovirus group, which is the bigger family to which this novel coronavirus strain belongs. And then the other targets in the test is then specific to this novel coronavirus that we see circulating now. So if there would be any mutations, the group targets are very broad, and it basically detects even the old SARS coronavirus strain, which belongs to this group. So that will allow us then to identify if there's any new or mutated strains that are circulating. So for those cases, we will then depend on sequencing of those cases or the tests following testing for those specific cases. And, you would do what we call confirmatory testing, and if it stays the same, you will have to do what we call DNA sequencing to determine what is the changes that happened in this specific virus then.
All right, Dr. Florette Trinnet, Head of Department at the Medical Virology from the National Health Laboratory Services. Thank you so much indeed for your time and your insights. Okay, we're going to take another quick break, and after that, we're going to take a look at the precautions being taken at our correctional services facilities to try and prevent COVID-19 infections amongst inmates and infections, of course, between officials and prisoners. Stay with us for that. Right, welcome back. You're watching Health Talk, and we're exploring COVID-19 and its various places of influence, I guess, where it might and might not infect. And the South African Justice System Crime and Prevention Security Cluster briefed the media earlier in the week in Pretoria on COVID-19 measures. And the Minister of Justice and Correctional Services, Ronald Lamola, also mentioned that precautions will be put in place in the country's prisons to protect inmates from contracting the virus. This is what he said.
We also want to confirm that with regard to correctional services, there has been processes of sanitization and cleaning, deep cleaning of some of the correctional centers, which are still continuing as we speak since the period of the lockdown. And there have been suspected cases from our officials, about 16 officials, and 11 of them have now been cleared through processes of testing. Those ones where there was a suspect, particularly is those that might have traveled outside the country, or those that might have, it was only one who were suspected to have been in contact with a person who might have been positive, and we are still awaiting results for the 5 officials. At this stage, all procedures are being followed as guided by the Department of Health in that regard. And we will proceed and continue to do all the measures that are necessary to ensure the safety of the inmates who are all in our correctional facilities.
Now, one of the measures designed to curb the spread of the COVID-19 pandemic, announced after President Cyril Ramaphosa declared a national state of disaster on March the 15th, was that no visitors would be allowed at correctional services facilities. But the impact of this will have on offenders and even prison officers in South Africa, it's already severely overcrowded facilities, is unclear at this stage. Well, to talk to us about this, we're now joined via Skype by Singabako Nxumalo, who's a spokesperson for the Department of Correctional Services. Thanks so much indeed for joining us. Welcome to the program.
Thank you for inviting us.
And on the line, we also have Golden Miles Budu, who's with the South African Prisoners Organization for Human Rights. Let me start with you, Mr. Budu, actually. The stopping of visitors coming to the correctional services centers, some might feel that, that's the one thing that inmates look forward to, and this has been taken away from them, but it is for their own good. What's your view?
Look, Peter, thank you very much. Look, to start with, prison promotes the violent resolution of personal conflicts, and it breaks apart bonds of immediate and extended families, close and distant friends. Peter, prison fosters dependency, idleness, violence, and deteriorate human relationships, all of which make education in prison, training, skills development, rehabilitation, and ultimately reintegration as law-abiding, useful, and productive citizens virtually possible. But we are told it is for the better of these inmates. But one must also be wide awake of the indisputable fact that you've got correctional officers that move in and out of these facilities. Then you get unsentenced offenders that also move in and out, going to court and coming back and so forth. And I want to make a clear call to the Department of Correctional Services, like the President did the other day. He called on all the opposition parties to put aside their squabbles and their petty politicking and work very hard to make sure that we overcome this killer disease.
All right, so just a quick one. What do you think the psychological impact might be on an inmate not seeing someone? Because we don't know that this is just going to be 21 days. It could be much longer.
It is not only the psychological deterrent it has on inmates, but it's also a mental and emotional, deterrent it has on both sentenced and unsentenced offenders. And we don't want to get in argument with the Department of Correctional Services anymore. We just want them to work with all of us who are having it hard, the welfare of these people who are there for the wrong or the right reason. And by the way, the Department of Correctional Services have got a stakeholders department or unit headed by a certain Mr. Gabriel C. Kamela. They should have by now worked out a strategy how civil society get involved, assisting the Department of Correctional Services to get to the bottom of this thing. Because currently, it is the Department of Correctional Services that talks to themselves as if they are using a toy cell phone.
All right, you've heard those comments, Mr. Nxumalo. Any thoughts on that?
Firstly, I think it's important to highlight that as a department, when the whole coronavirus epidemic ascended to our shores, it meant that as a department, we really had to think hard and to say how best, can we put in place measures, one, to prevent the transmission or even the virus going to our centers. But two, we are alive that the virus is here, to say we need to put measures that now we look in terms of containment and treatment. And number three is around the whole issue of disaster recovery. For now, our plans are all focusing on prevention. How best can we prevent the transmission going inside our centers? Then the issue of the suspension of visits fits in well with that particular point. Because for us, if you are able to block people from coming to our centers, then you can deal with the issue of transmission. But then we all know it's not only families and visitors who could bring the virus inside our centers. Our officials are also capable of doing that. Hence, then, we had to say, under prevention, one, we don't just need to do screening, but public education also, educating our officials to say, what is this virus, how do you conduct it, and how best can you protect yourself and those around you. So we've been doing that because if we can win that battle, at least half of our work will be done. But we are not taking anything for granted because we know correctional centers are a closed environment. And in some centers, we have numbers which are really high. So we've got to ensure that you don't just sanitize and clean, but you also start, also looking at the spaces that you have, preserving certain areas that you use, for as quarantine sites and also some as isolation sites. So as a department, we've got a plan, we're implementing it, but for now, the critical point is on education and also making sure that we limit the movement in our center.
Are you able to control these things? Because, we see the stories about all the contrabands and things that go in and out of prisons, and we're shocked, people with cell phones and drugs and all sorts of things. If you can't control that, how do you think you'll be able to control the movement of this virus?
The 30 days which has been put in place, suspending the visas, has really assisted us even in terms of the raids that we're conducting to say what type of these illegal items are brought to our centers and to say who are the real transporters of these items. We know that some of our officials do play a part, but now movement of our officials as well, is very controlled in a way, and also the activities taking place in our center. So it's giving us a better ideas, where the gaps are. But as a department, we are very clear. And when you talk of a virus, something that affects everyone equally. So our officials are fully aware that, they're also at risk and inmates. So everyone will want to make sure that, I'm protected, I'm sanitizing, and that even people around me are aware of their responsibility, of which is working for us, for now. But ours at this stage is more about education, because we are also dealing with this preconceived idea where people believe that everybody needs a mask, and glove, whereas it's not about that. But we have provided those personal protection equipment in order to ensure that we don't put lives of people at risk.
All right, so Mr. Budu, are you concerned that, people may be arrested over this time for not adhering to the lockdown regulations, and we don't know whether they're carrying this virus or not? Are you concerned that some of these people will be mixed with inmates at various locations of custody?
Well, the way we are concerned as an organization, the relatives of sentenced offenders themselves, social justice-loving people, and good people within the Department of Correctional Services and law-abiding citizens, we're just praying. We are depending on the Father and the Son and the Holy Ghost that this disease enter into these high walls. Because if it ends up there, I'm telling you, the rest will be history. But I also want to remind the Department of Correctional Services as a whole. The spokesperson, Sri Babonke, might not be aware, but the Minister and the National Commissioner is well aware from the side of offenders what is happening behind these walls in terms of, not talking about what we have picked up the other day when we deal with offenders who are calling us, calling the media, calling everybody. But the Minister is aware of what is happening, and if recommendations that were made during an ex-offenders conference were taken seriously, these recommendations were made on the 23rd to the 25th of July 2015, at the hotel called George Hotel in Irene. If those recommendations were taken seriously, I'm sure the Department of Correctional Services was not going to be running around and trying to cover up and try to speak a lot of English and say nothing. If we as an organization were given an opportunity to work with the Department of Correctional Services, we were going to make sure that the national state of disaster declared rapid effective response system is implemented in terms of intensifying measures for hygiene control, ensure hygiene measures, monitoring systems, mass campaign of education, minimizing of physical contact, and so forth. But all we can do, we can stand here on the sideline, scream from the top of our voices, and plead with the Department of Correctional Services. Can we please work together? Because this is just the beginning of other diseases that is coming into this country.
All right, so we're going to have to leave it there. Golden Miles Budu from the South African Prisoners Organisation for Human Rights, thanks very much indeed for joining us on the line. And a very quick question for you, Mr. Nxumalo. Social distancing, how can that possibly happen in a prison system that we know is overcrowded?
We're amazed by, the insight that we've received from various players, in the medical field. And it's strange that Mr. Miles saying we're not working with other structures. But what we have done, in addition to the centers that we have, where we've made space, is that we've also procured mobile sites, which will really assist us in terms of, moving other inmates to those sites whenever they fall sick. It may not be the coronavirus, but even other illnesses, so that we make sufficient space. But the coronavirus has even pushed us to come up with a new standard operating procedure, which will ensure that we do find means to create social distancing, which even talks to the manner in which you release inmates to go into the courtyard, how to ensure that there is even space there. There are a number of creative means that we're putting into a test, and some of them are quite interesting. But in this, we're also working with inmates to say, here's a situation, how best can we come up with solutions to this?
All right. You know what? Let me just take a quick call before I say goodbye to you. And we're joined by
Mr. Morgan from Warrington in the Northern Cape.
Hi, Mr. Morgan. How are you doing?
Very well, and you?
Good, good. I hope you're staying safe. What's your question?
We are staying safe. I'd like to ask the prison department, why don't they release the prisoners of 50 years and older?
Okay, there you go.
I mean, China did it.
All right, let me put that question to Mr. Nxumalo. I suppose it's not up to you, is it, Mr. Nxumalo?
It's not up to us, but we know what's the motivating factor behind that question, because they've seen it happening in other countries around the world. But as South Africa will say, if we can really push prevention measures, we'll win this battle and also contain and treat. Definitely the issue of premature releases will not even be a question, because it affects a number of people. You cannot just release a person before serving, the complete sentence. So that would be a new discussion altogether, and a high risk, if I might put it like that.
All right, Mr. Nxumalo, thanks very much indeed for joining us and giving us some insights to some of the work that you're trying to do inside the Correctional Services facilities. Thanks so much for your time. All right, so we're going to take another quick break, and when we come back, we'll share with you some issues around how to protect yourselves and others around you from infection. Stay with us.
All South Africans will have to stay at home.
As the Nelson Mandela Bay Metro or municipality, we have about 5 venues to cater for the homeless.
Officials say approximately half of the 4,000 homeless people in the Cape Town CBD are already being accommodated in shelters.
You find about 8 people who are sleeping in there. The chances of them infecting everyone in there, they are very high.
I think we underestimated the numbers. At least now, the situation is firmly under control.
We're trying to keep our hands on the pulse for the homeless in the city as part of our President's call.
Welcome back. We're starting to wrap up Health Talk this morning, and we thought we'd leave it with some wise words and some advice. As the world steps up to the challenge of controlling the COVID-19 virus, you may be asking yourself, what precautionary measures do you need to take to flatten that curve as we've been discussing, and what does that mean actually, flattening that curve? Well, joining us via Skype once again is Dr. Yoken Pillai, the Deputy Director General for Health Programs from the National Department of Health. Dr. Pillai, we can't say this enough, we can't share this information enough, so let's go again. We're quite a way into the infection process, and we've learned a lot of things along the way. What would you say are the top precautions that we can take to help stop getting us infected and slowing down this infection rate? Hello, Dr. Pillai, can you hear me?
Right. I think I'm back, Peter.
Right. Okay. I was just saying top tips to stop us getting infected and to flatten this curve.
Yes, no, I mean, absolutely essential. So we must continue with hand washing with soap and water for 20 seconds, as well as an alcohol-based sanitizer. So that's one. The second is cough and sneeze hygiene, coughing into your sleeve, or using a tissue and discarding the tissue safely. And, we through the lockdown, we've made a fair number of comments around social and physical distancing. So I think that's one of the key things that the lockdown has introduced, and we must continue with physical distancing, standing around 2 meters apart from each other. And of course, we need to be really conscious of when we have symptoms that relate to the virus, and seek medical attention when we have these symptoms. Because the symptoms are really indicative of being infected and the incubation period that we all know about, the 14-day incubation period. And during that period, unfortunately, we will be transmitting the virus to others. So it's very important to have a look out for symptoms as well, and then self-isolate and get medical treatment should the symptoms progress beyond being mild.
All right.
So those are the key things.
All right. Before I let you go, let's just take a quick call, and it's Ditebogo, I think, in the Northern Cape.
Yes, sir.
Hi. What's your question or your thought?
It's a question.
Okay. What's your question?
I'd like to know, is it legal for one to consult to a traditional doctor during this lockdown?
All right. Ditebogo, that's a good question. Thanks so much indeed. Dr. Pillai, your best advice? I know that traditional healers are working with the health system. They also want education. What's your advice to people about whether they should go to traditional healers for some kind of help?
So I guess the key thing about these symptoms is that, they're not psychosomatic and they're not cultural. It's caused by a virus. So our preference would be for people to seek medical attention in the first instance. The things that are cultural in nature and those that lend themselves to psychosocial interventions are things that are more likely to benefit from a traditional healer. We also don't know which herbs that herbalists, for example, use are useful. So we are not suggesting that either. So we are really asking our people to seek medical attention in clinics and hospitals, as well as their GPs, should they have any symptoms.
Dr. Pillai, we're going to have to leave it. We've run out of time, but thanks so much for all the time that you gave us today and important information. Thanks so much and stay safe.
Thank you very much, and you stay safe too.
Thank you so much indeed. And thank you at home as well for watching Health Talk. Join us again next week at the same time. And it's been a pleasure for me to stand in today. I've really enjoyed it. And thank you for allowing me in your space. This is Dr. Ndoro signing off. No, I'm joking. I'm joking. Bye-bye.